COVID-19 has profoundly impacted the healthcare industry, and this week we share the importance for patients to continue routine care appointments for chronic conditions and cancer screenings. Today, our Lindsay Amundsen shares how a big drop in such appointments has affected local clinics.
100% of primary care practice were negatively impacted by a coronavirus and a significant drop in revenue.
Dr. Peterman says in the early stages of coronavirus, there was about a 70% decrease in revenue because
there was a 70% drop in the visit rate to our clinics. Very quickly, the televisits increased so that 30 to 40% of the visits we had at primary health were televisits.
Telehealth visits only made up for a small portion of revenue lost, but that wasn't the only thing that negatively impacted the clinic.
Our expenses went way up because we had to purchase all the PPEs. Then were a shortage of hand sanitizer, desk wipes, masks, and suddenly the prices on all those things went up.
So he says they spent 12-hour days redesigning every aspect of how they saw patients.
Answering the phone, making appointments, bringing the patient back to see the doctor, the interaction of the nurse with the patient, every step, the room configuration. There isn't any process that hasn't been impacted by coronavirus.
This includes separating their clinics into what they call respiratory clinics and, quote, clean clinics.
Those patients that needed regular well visits, those visits were at, quote, our clean clinics. And those visits in where someone had coronavirus symptoms or other symptoms that were, quote, illness related, they were directed to our respiratory clinics.
Since establishing the, quote, clean clinics, he says primary health appointment size is back to normal.
Once we were able to say to the patients and to our staff, we can see you safely, in a sense, in a clean environment, then our patients began to come back.
As COVID-19 is continuing to change and as we learn more about it, Dr. Peterman says they have to keep redesigning the process in which they operate in order to keep everyone safe. Lindsay Amundsen, Idaho News 6.